Introducing PEARRL, Pharmaceutical Education and Research with Regulatory Links. PEARRL is an EU-wide consortium designed to educate the pharmaceutical scientists of tomorrow. Combining industrial, academic and regulatory expertise, PEARRL will train 15 PhD students in the areas of bioenabling formulation, biopharmaceutical tools and in silico modelling. Coupled with secondments to both industrial and regulatory partners, PEARRL will create the well-rounded researchers needed to face the world's future healthcare challenges. Now a little more about me. My name is Daniel Price and I originally hail from Liverpool in the United Kingdom. I have a master's degree in industrial medicinal chemistry from the University of Leeds. Now part of the PEARRL organisation, I'm based at Merck in Darmstadt and I'll receive my PhD from Frankfurt Goethe University. My supervisors in this endeavour are the excellent Christoph Saal, Anita Nair, Jennifer Dresman and Martin Kuntz. My PhD is entitled The Development of Mesoporous Silica Formulations. During this process I hope to show increased understanding, increased applicability and the development of an industrial scorecard for mesoporous silica. But hold on, what's mesoporous silica? Well, a wide range of drugs in development are often very highly crystalline. The problem with these drugs is that they are also very poorly soluble. This low solubility can lead to low and variable absorption in the GI tract. This in turn increases the risk of attrition, which can drive up the cost of drug development. A potential solution to this problem is to utilise the amorphous form of a compound. This form is innately more soluble than the crystalline counterpart, however it is much more poorly stable and so should be formulated in a very considered manner. One such formulation that can yield the stable amorphous form is mesoporous silica. Mesoporous silica is a silicon dioxide backbone which is highly peppered with mesopores of around 5 to 50 nanometers in diameter. Mesoporous silicas have very high surface areas, up to 1,000 meters squared per gram. As a result, they are very highly functional. For example, when mesoporous silica is combined with crystalline API in an organic solution, it can uptake the drug within the porous network. Once located within the pore and the solvent removed, the API becomes trapped in the amorphous form, which is stable for shelf life relevant timescales. This is drug-loaded silica. Once administered to the body, we can then reap the rewards of increased solubility and absorption which this stable amorphous form can offer us. Now, as efficient as mesoporous silica can be, it is still relatively novel and therefore there are a lot of unanswered questions surrounding this technology. For example, number 1, how exactly is the drug taken up within the pores? The loading process. Number 2, what is the nature of the pore-API interaction? The entrapment process. Number 3, how is the drug released from within the porous network into solution in the body? The release process. And number 4, once the drug is in solution, we must introduce a stabilizing factor such as a precipitation inhibitor. What is the nature of the interaction between the API and this stabilizing factor? The metastable process. ESR3, that's me, hopes to answer these questions and more and contribute to the global knowledge surrounding mesoporous silica and supersaturable formulations. If this has interested you, which I hope it has, you can find more about my project at the PEARRL website. Alternatively, you can reach me by email or please connect with me on LinkedIn or Twitter. Thank you for listening. Please go and have a look at my fellow ESR's videos. That's all from me. Here's to the future.